Hi class, welcome to Principles of Nursing Care, Skin Assessment and Pressure Ulcer Staging. My name is LaRonda Smith and I'm going to be your clinical educator and instructor for this class. In this class we'll be focusing on the who's, what's, when, and why of skin assessment and pressure ulcer staging, as well as focusing on and discussing prevention measures, treatment, and patient and family education. I challenge you in this course to set a goal for yourself to learn something new that you have never learned before, as well as take your newfound knowledge back to your colleagues so that they and you may use this information to enhance your nursing skills and nursing care. Before we delve into the class, however, I do want to tell you a little bit about myself, as I have asked you to do in your discussion post. So again, my name is LaRonda Smith. Born and raised in Raleigh, North Carolina. I have been a nurse for a little over 24 years. I have always wanted to when I grew up, I wanted to either be a teacher or a nurse. So I started off with nursing, and now I have come around 360 to teaching. I think in your nursing career, you will all find that you are a little bit of everything. You're a teacher, you're a nurse, you're a mother, you're a sibling, you're a doctor, you're a pharmacist, you're some of everything. But formally, I have now come back around to advance my education, and I'm in a grad program for the Master Student of Nursing in Education. So again, nursing for 24 years. I graduated in 2001 from UNC Greensboro and started at WakeMed in that same year on a urology, renal, cardiology floor. We did a lot, and it was a very hard floor as a new graduate nurse, but I did learn a lot and gained a lot of experience working on that unit for 10 years. We primarily dealt with dialysis patients, patients with urological surgeries, and cardiology telemetry patients. So again, we touched base on a lot of things on that unit, and it was a good foundation. I then transitioned over to interventional radiology, where I did a lot of pre and post procedural nursing, radiology nursing with moderate sedation and CT scan, vascular surgery, neurosurgery, MRI, nuclear medicine. So again, that was also a great learning experience for me. And in that department, I was also able to learn how to place PICC lines and become a vascular access nurse. I was also a mobile vascular access nurse doing private contracts with a company for several years. So again, I enjoyed that part of my nursing career as well. After about 9 years in interventional radiology, I transitioned over to a WakeMed, kind of like a standalone ER in WakeMed North, because I did have an interest in emergency medicine as well. And this location was a level 2 trauma center, which made it a little bit easier for me to transition over into that realm of nursing, as we all know how ER nursing can be. However, again, this was a great learning experience. It wasn't too overwhelming, and I definitely learned a lot. After being at WakeMed North for several years, this was around the time that COVID came about, so I did transition over to doing some travel nursing in 2020, I believe, and I did that for about 3.5 years until 2024, which leads me to where I am now, which is at UNC Chapel Hill in an oncology lab draw clinic, where I get to go back to using a lot of my vascular access nursing skills. Again, one part of nursing that I have thoroughly enjoyed. And it is, I guess I would say, my passion and my most, the part of nursing that has my interest peaked the most. However, given all of my experience in the med-surg, emergency department, radiology realm, I've also done some home health up and down the East Coast, different cities and states, different patient populations. I think that has allowed me to feel confident in teaching you this course and giving you the information that you need for proper skin assessments and pressure ulcer staging. As far as my personal life, things I like to do, I love music, so I love going to concerts, especially in the summer, going to outdoor concerts, and I will travel to a concert if it's the right person. I love being outdoors in nature, biking. I am definitely a summer girl, spring summer girl, so I love going to the beach. I love traveling, and my favorite place I have been so far is Bali. I pretty much want to hit up as many islands as I can. I love cruising, and I have been on several cruises in my life so far. To the Bahamas, to Grand Cayman, to Cozumel. I like to be on the go as much as possible. I am married, and I have a 15-year-old daughter and a little Pomeranian named Bear, who's very mischievous but also very cute. Talking about the dog, not my daughter. And I just like hanging out with my friends and family, gathering during the holidays, during the summertime, just enjoying each other's company and making memories. I hope that this class turns into a good memory for you. We are both on an educational journey here. As I said, I am in grad school now. So we will hopefully both learn and grow together throughout this course. If you have any questions, concerns, please feel free to reach out to me. Otherwise, I will see you in class. Welcome and good luck.